There we go.
Okay.
All right. We apologize for all of you in YouTube land. We're back. Had some technical issues. Our next appointment here, and we haven't discussed anything else here, is the public hearing resolution 2025-05, authorizing an election on the question of whether to permit San Juan County to collect, retain, and expand revenues collected from property taxes in excess of the newly enacted 5.25% growth limit imposed by state law. We discussed this, previously, but this is a public hearing. We will go ahead and maybe introduce this a little bit, and then we'll take any public comment. Yeah, just I think for the sake of clarity and the record, Willie and Dennis, do you guys want to kind of explain the reasoning behind resolution 2025-05 for those who may not have been aware of it before?
Dennis, you want to jump on that?
I mean, I could do it too if you want.
Give me just a sec. I'm having problems with my audio. I'm sorry. Hold on.
Okay. Yeah, you're a little quiet, but we can still hear you. Yell real loud.
Good night for technology.
No?
Let's
Yeah,
try this.
There you
Yeah.
go.
Okay.
Yeah.
All right. So the legislature put in place a 5.25% cap on growth, and this is it's a formula for calculating growth that is a little bit complicated, but Willie's done the numbers on it, and it does appear as though the 5.25% cap would impact us to the tune of Willie, between 70 and 80,000 in 2025.
Yeah, about 85,000.
85,000. And the statute allows for counties to present a ballot measure simply opting out of the cap. And some people are calling it a re-debrucing. And whatever you want to call it, it has to go before the voters. It is very specific about one sentence that must be stated. Other than that, it doesn't give any other kind of guidance as to the language, if anything else that needs to be in there. I know there's a split on opinions regarding whether or not you should include the typical sort of debrucing language that says the county shall be able to retain and spend all of the funds, et cetera, regardless of any statutory provisions that might limit it. Some attorneys are out there saying you don't need to do any of that. You just need to state the magic first sentence, that says, shall San Juan County waive the 5.25% cap pursuant to the statute. I tend to think if you're going to do it, I like going ahead and doing the the belt and suspenders route and going ahead and putting some language in there. It also gives the county an opportunity in the question itself to provide a little bit more information in there for the voter. But that would be sort of your decision. I think either way, you have two different drafts. Either way, it would be effective. I tend to like the longer one. Attorneys like words sometimes, and sometimes they matter. And I think that the longer one is just a little bit more, it's just a little bit safer, in my opinion. If you don't do this now, you can do it later. Obviously, there's consideration that we're in a off election year. That's sort of your decision as to what impact that's going to have on this. I will also point out that the resolutions I drafted do have a publication 4 times after if the board passes this. I don't necessarily think that's a legal requirement, but I think it's a good requirement, especially to get the word out there and have the constituents ask the county any questions they might have about it. And just as a reminder, under the election laws, once you guys choose to go down this road, and if you choose to go down this road and place the ballot measure, you are not allowed to actively campaign for the ballot measure at that point. So you can invite people to ask you and explain what it is and things like that, but you can't actively campaign and you can't send out flyers and things like that. There's a fine line. Yeah, there's a fine line. You can answer questions. If a reporter came in and interviewed you, that's fine. The board can actually take a position, but they can't actively campaign for it. So just keep that in mind. Let's see. Anything else I missed that you guys are unclear on?
No. The only thing that I saw in here, and you guys can, that we could add to strengthen the language of this, and I don't think it really is honestly going to be read by enough people to add it in there. But if we added another whereas that stated the last time that we raised the property tax mill levy, that just explained that, San Juan County whereas San Juan County has not raised the mill levy since, I mean, I think it's been about 40 years, but
I have no idea when the last time.
it might, like I said, I'm not sure that it'll be this will be read by enough people to justify the research and the last time the mill levy was raised, but it's outside of our institutional memory, let's put it that way.
Yeah, and I mean, and that, we're not asking to raise the mill levy.
No, I know,
Right.
but I was just saying
that kind of confused me right there.
Since
We're not,
yeah,
I got it now.
just saying, that we haven't raised the
Right,
mill
we
levy
haven't.
in this
Yeah.
amount of time, and we're not asking for a mill levy increase, but.
Oh, okay.
Yeah.
Clarify that.
As a clarification, that was the
Got it.
only thing that I could add that I think would, strengthen this resolution, but.
I got you.
Yeah, it sounds like maybe that might create more confusion than clarity.
It did with me for a minute.
Okay.
I'm okay with it.
And Willie raised the issue that today, which I thought was a very good one, and that is, even if it wasn't going to impact the county significantly, and I don't want to say 80,000 or 85,000 is not significant. That's a pretty significant number, but even if it's not a huge number now, I mean, if you don't do this, what's this look like in 10 years, 15 years? I mean, these things hang with us forever. And I mean, all of a sudden, what if we had double-digit inflation? Then are we all of a sudden scrambling to try to do this or do something else or raise taxes? It seems like if there's a fair shot at getting it passed this time right now, why not just take it off the table like we did with Tabor debrucing and with the 5.5 cap that they put on years back? I mean, this will be the third one. So
My kind of personal take on these numbers is that even with Tabor debrucing, the rate of increase in revenue does not match the rate of inflation. So.
Well, and I mean, I could make the obvious observation that, you've got Denver struggling, you've got the state struggling now. And, I'm sorry, but they sort of created it. And I say sort of generously. They did create it. And now it seems almost ironic. But Yeah, policy is your department, but it does seem to make sense.
I guess my only concern is, like Dennis said, it's an off election year. What's the special election cost? That's what we need, right?
No,
Or we wouldn't,
No.
or we
there's
can
just
just,
an election, it's just not,
I mean, put this on the ballot, is what I'm saying.
there's already an election going on because the state's got an issue. School
Okay.
board election,
So doesn't cost anything.
I think, the fire district, Durango Fire Protection is gonna put on a.
Okay, so it's not a special
So it's
election.
not costing-
There's no cost.
Well, it's costing us a little bit, because if we weren't involved at all, then the other entities.
Right. But it's not an exorbitant cost.
So,
Okay,
yeah,
okay.
Awesome. Yeah, are we ready for public comment?
I think so, unless you want me to go over some of these numbers, or we can do that after the public comment.
Let's go ahead and take public comment now and we'll do the numbers after.
Tax election things only happen in off years. That's why it's now.
Okay. Melody, do you have any other public comment you'd like to share? Cause now
For the
open, no, just for this issue. I guess you have your time now, so if you'd like to make your public comment about something else, I guess.
You want me to do it?
Well, you could make it now and then that way then you can go home, yeah.
I've recently become aware that down at the annual housing, everybody who got a piece of land had surveys, and somehow during the construction, all the survey markers were removed. And this is not the fault of anybody who owns property, but apparently there's a little bit of a question as to who owns to where. And I said this to the town Monday night, and I'm saying it to you. Somebody needs to replace those markers for those folks. Thank you. Have a lovely evening.
Thank you.
Okay.
Yeah.
Melody, we've replaced them a couple of times.
We have,
Yeah.
we brought in the county surveyor and in fact, we just did,
And we just did a
Yeah,
property
so-
on there where
What did you just say, but I didn't hear that.
we just had the surveyor put in some corners for a property down there.
Well, some of them are saying they still don't have them, but I'll let you run on it.
Well, the reality is we've done it several times. It's not the town's responsibility to put in survey corners for you if you wanna know where your boundaries are. It's your responsibility. At some point, it has to be their responsibility.
Yeah.
That's true, but they bought the property with the survey markers.
Right.
So
They
I
did.
don't think it's fair if they were removed by
Well,
construction. And if I'm.
Actually, that actually makes it their responsibility.
It may have been, it was probably their construction when it got removed.
Yeah.
It got removed.
correct.
I think that's true, but
And it's kind of, I mean,
I'm not gonna say my next thought, sorry.
yeah, I've had it on a couple different properties as well that, it should have come with survey markers. Sometimes they get buried and just have to be relocated with sometimes, plowing and regular traffic and things like that
Yeah,
can mess things up. But typically, when you remove a corner for construction, you're supposed to call the surveyor and have the surveyor come and basically mark where the pin went. And then when construction's completed, they can then put it back at a lot less cost to the,
And,
I wonder if that's been done for everybody.
Well,
I'm hoping you'll ask.
well,
yeah,
and.
every time I've had it done, it's been my responsibility to do that, not anyone else's.
And generally speaking, when we've been building the houses in the donut hole, the middle, the round part
Okay,
with the donut hole. As needed, we've called in the surveyor to find the pins, but generally, the contractor's been able to find the pins down there, he just has to look for them.
Yeah.
that's nice. I didn't know that, and I'll tell a couple of people that.
And we have had the surveyor down there multiple times a year to,
Can
to
you
be-
just have
to
him
be
live
making
there? Does
sure
he want a
it's-
house?
he has an apartment here.
Does he?
and I will tell you from the construction standpoint, because I work a lot down there. We try to, if we know something's gonna happen, we try to put a piece of rebar or something.
Yeah,
Yeah,
That, we try to reinforce it, so,
well,
or offset it.
But yeah, we are aware of some of those issues that
Okay,
folks have
thank
been
you.
having with surveying too, and we've been discussing that with some of the.
I said something Monday, they asked me to come here and say something here.
Yeah, sure.
So if I'm wrong, I'm wrong, and I apologize.
Oh, we appreciate the attention to
We
it.
tried to work with it.
Yeah.
Let's put it that way.
Yeah, and the county has definitely picked up some surveying costs that maybe we shouldn't have to incur, but we have, because we're trying to own.
We did have one
We'll
replaced
have
on ours because it got moved and,
Yeah,
and we went called, but it wasn't like, because of the house construction, it was done.
Yeah,
But, since these are public housing, I think I thought it was a slightly different issue than what we would. So I appreciate your consideration and everything you're doing for them. They're getting pressure to put the fences in the right place and stuff, and I guess they're having a hard time finding markers.
yeah, and setbacks and things like that, with annexation and different things have moved around based on the county ownership, town ownership.
Yeah, I know that too.
Yeah.
But that's why I said it there Monday, and then somebody asked me to come over here and say it this week.
Sure.
So I've done my,
Yep,
my good deed for the week.
Yeah,
thank you.
thank you.
Thank you.
Yeah, enjoy the rest of your evening. Okay. Sorry for the pause and the delay in that, but it is a public hearing, and sometimes that's what happens with public hearings. Back to our matter for resolution 2025-05. We do have some other folks here in the room, and we have not closed public comment, so if any of you would like to comment on the resolution 2025-05, the election question on whether to permit San Juan County to collect, retain, and expend revenues collected from property tax in excess of the newly enacted 5.52% growth limit imposed by state law. Please go ahead and do so now. Okay, seeing none, we will go ahead and close public comment portion of this resolution public hearing. And open it back up to staff and discussion, staff and
just to
discussion.
I threw a bunch of numbers in your packet and, just to kind of go over them a little bit, make sure, clarification. So the one with the blue and the white stripe page with the yellow is, my understanding is that the base year is the 2023 property tax assessment year, which is what we collect in 2024.
Mhm.
So that's our base year. My first concern was that 2023 was our base year, and we were going off of that, and that would have really been harmful.
Yeah.
But if that is in fact correct, so our 2025 property tax actually was a decrease from 2024 because the values went down just a little bit. Usually happens in between appraisal years. The value goes down a little bit. So, what we would have been we ended up collecting 1,393,000. If values have gone up, we could have collected essentially another $90,000. But now as we go into 2026, our assessed value goes up to $86,619,246. So without the limit, we can generate, or we would generate at full mill levy. And this, I'm just talking general now, there's actually, road and bridge and social services, but they're relatively minor. So we would bring in $1,635,756. With the 5 and a quarter limit, we'd be $1,560,000, or essentially a loss of $85,352. In the following year, assuming our mill levy or assessed value stays the same, it'll actually probably drop slightly, but it'll be in that same ballpark. We can again go up 5.25%. So even if the values go down or or smaller increase than that. We can, go up another quarter, which would, generate, without the limit, it would generate 1,645,000. With the limit, it'd be 1,642,000, so a loss of only $3,430. So over a 2-year period, and that's what you're looking at basically is 2-year cycles.
Yeah,
We'd be down 91, almost $92,000, which isn't critical to our budget right now. We're fairly healthy. We've got a decent fund balance, so it would take a few years before we started to feel the pain too much, assuming nothing else changes. My concerns, and Dennis touched on it, is that with all the issues and budget cuts at the federal level and all the issues and budget cuts at the state level, that all rolls downhill. They keep supplying us with mandates, unfunded mandates. And with, essentially what we're gonna be seeing over the next few years is fewer revenue sources coming in from the state and federal government, but more and more demands and requirements to pick up additional portions of these demands that, Martha's online. And, there's a good chance we're probably gonna, if the state doesn't have money to pick up the cuts from the feds and social service programs, if they're gonna stay at that same level, we're gonna see increased levels or decreased state funding. So that's my concern, is all of a sudden we have this impact coming up from the state and federal government, putting more of a demand on us. And if we've limited our revenues, it's, it's potentially gonna put us in a pinch. And like I say, probably not in a year or two, but down the road.
yeah.
The next page, just out of curiosity, basically a 25-year time period, 2021 to 2025, based, I put out what the assessed value was, what the change in, a percentage of change in assessed valuation was. And as you can see, there was a lot of negative, assessed valuation, especially after, 2009. That's when the recession actually hit us. We were, because of the way the, reappraisals happened, they're basically 2 years in arrear. So that's when it started hitting us. And so then I show what our actual revenue was. And then I adjust it for inflation and show that 2025, when adjusted for inflation, based from 2001, is really what we were collecting in 2006.
Right.
So, I mean, we're almost 20 years out to get back to the revenue source where we were 20 years ago.
Yeah,
And then take it one step further, I did the what if. What if those 25 years we were controlled by the 5.25 limit?
yeah,
And if we hadn't been DeBruce, we would have been controlled by 5.5% limit, which wouldn't have been much better. But when you add those revenues up, so 25 years of revenue without restrictions generated almost $23 million in revenue. At a 5.25 limit, it generates 16 million in revenue. So we would have been short, or we would have been down $6 million over that time period. And I think, quite honestly, the revenue that we'd have coming in at this point, would have been long past critical.
yeah.
So that, that's my concern, is on the short term. I don't think it's gonna have a major impact on us. long-term, it's essentially, I mean, it really does function like Tabor did, it has a ratchet down effect. You keep, you know, instead of having your income compounded and increasing, you've got your revenues compounding and decreasing, so you keep losing a little bit each time, and, you know, unless, your values are essentially 5.25 or less every year, you know, you're gonna keep losing ground, and, you know, if history is any indication, you can see that, over a 25-year period, it could be pretty substantial. So,
I had a question and a comment, Willie, if you don't mind.
Dennis, we
Yes,
can't,
we'd
we
like
can't
to.
hear you
We'd
very
like
well,
to.
so you might wanna put your earbuds back in.
How's that?
Very good.
Okay. So Willie, you saw that I added 2025 as inclusive in this resolution. Was that necessary in your mind? I think it is, right?
say that again?
Well, it's odd because the waiver language tells you can waive a specific year or all future years. But it seems to me that we would have to waive 2025 and all future years. Do you
Yes,
agree?
no, I think you're right, yeah.
Yeah.
I think that's what we wanna do.
Yeah, which is odd. It's just weird the way they wrote it. And then did have a typo on in one of the paragraphs where I referenced 29/1/1704 instead of 1702 in one of the spots, but we could fix that if you guys want to move forward. And then lastly, just a comment. I felt like it was pretty obvious why the legislators did this. It was because we saw this huge spike in property values, and it seemed like it was going to just be a big increase in taxation across the board. And I just didn't see that. I don't think they saw these cuts coming. So I think it was just a timing thing more than anything. And it is in the last whereas. You'll see the 29/1/1704 in the last whereas, Willie. That should be 1702.
Okay, in the last whereas, it should be 20, say that again?
It should be 29/1/1702.
Okay.
That's all I had.
All right, do we have any additional discussion from the, from staff or commissioners here, or should we, make a motion?
I don't have anything more.
Yeah. I mean, I think it's a valuable effort to try and maintain what we have, and I think kind of in the situation that we're at with the state and federal funding cuts, it's a pretty critical vote for us now.
And we know they're gonna continue.
Oh, it's gonna continue. Yeah, I don't see the state of the feds, you know, all of a sudden next year turning around and the trickle down effect coming back to us.
Well, and I think just also to point out, two of our agenda items tonight are
Yeah.
in need of funding.
Right.
Yeah.
You know, the child care, social and family learning center and the health clinic, and you know, those are both priorities and
Affected by the state.
critical, and you know, if we can pick up 85,000 that we don't have, that gives us some
Yeah,
some funding resources to help out both of those areas.
well, that, I'll,
Are you entertaining a motion?
I'm entertaining a motion. Do you want me to entertain the full motion?
No,
I'll entertain a
can-
motion that we,
Let me just,
oh, sure.
as way of, reading the resolution, I'm just gonna read the title if that's okay.
Sure, yep.
Resolution 2025-05, a resolution authorizing an election on the question of whether San Juan County shall waive the 5.25% property tax limit for 2025 and all future property tax years as provided for in section 29-1-1704 Colorado Revised Statutes.
And that's option B. On our drafts here,
What
that's the longer draft there, option B.
Yeah, that was.
Yeah.
Yeah, that was the second, that was a simple version. Willie, I think you want the first one.
Or the first one's the longer
I don't
version?
know.
I think option A
option A is
is the shorter one, I think.
let me see.
No. Option A is the longer one.
Option A is the one.
Okay.
Okay, so
And I think,
go ahead and read option A again, Willie, or if you'd like me to.
Okay, no, a resolution authorizing an election. Resolution number 2025-05, a resolution authorizing an election on the question of whether to permit San Juan County to collect, retain, and expend revenue collected from property taxes in excess of the newly enacted 5.25% growth limit imposed by state law.
All right. I'll
Okay,
entertain.
I'll make a motion. Do I need to read that again?
I think you just can say resolution
Okay.
2025
Make a motion to for resolution 2025-05 to yeah.
to
Put this
authorize.
on the ballot, authorize on the ballot.
Yeah, all right. Cool. I'll second, all in favor? Aye.
Aye.
All right. The motion passes and we can move on to our next appointment. We apologize, we're running just a couple minutes behind here, but if you guys would like to come up and have a seat, then that's what's going on.
Billy. Hi, Martha. Hi, Austin.
Hey.
Becky.
Aye.
Natalie Weaker. I'm here representing Silverton Learning Center.
Okay.
Now you sit here. Lucky me. Oh, lucky me. I'm the board president.
It was flip around too if you're speaking, so it's
The magic owl.
Yeah. Yeah.
Yeah, and we just wanted to officially come and explain what our new situation is. It seems like when it rains, it pours, and it is just pouring on our little learning center. I'll try to keep it brief as possible. We've had some meetings, Willie, and really appreciate that. And but I had to laugh because Holly Copenhagen and we've been part of the learning center for a very long time, and I just had to share an old article from 20 years ago. Yeah, and this is the preschool dream comes to fruition. It's been at least 1 decade since an idea sprouted to build a family center for Silverton's younger children. And the idea has faced a very bumpy road, chock full of obstacles, some of which seemed insurmountable. But the Silverton Family Learning Center in San Juan County, in cooperation with the town of Silverton, DOLA, Silverton Public School, and various funding agencies and foundations, were able to finally push the dream to fruition. And I don't know, we have our funny old file that we just brought out because we were feeling pretty depressed about our current situation. And I just know I'm like, oh yeah, it was such a rough road to get the learning center built. And it really could not have been done without the county and without our town and without all these agencies. And for the last almost 20 years, like, we were in a good place. We were sustainable. And with these big changes with CPP, the Colorado Preschool Program, changing to UPK, Universal Preschool, it's just been rough. And I know we weren't here too long ago. If you want to take a look, you can.
I was around then.
Okay.
Thank you. So, sorry. Appreciate that, but.
It's like, I'm still at my desk.
I got that, yeah. Yeah, no, we help with the digging and building of that, so
Yeah.
it's a great place, yeah.
And it's still standing, it's just, yeah, so back to, so UPK. So I know when we were here a couple months ago with the lodging tax, and we asked for that certain percentage. And that did really help us, and our budget was looking not beautiful, but it was like, we had enough to get by month, not saving anything, but able to get by. Come August 1st, we received notice from the Colorado Department of Early Childhood Education that the historical funding that we have gotten for forever, especially for our 3-year-old funding, it was just the set amount. Historical funding, you'll always get this 60,000. And it was just kind of like, this is what we have. It was great, we depended on it. Having that taken away August 1st and finding out about it was obviously really messy. And made me really worry about just being able to cover payroll. Yeah, and we actually do, we have a pretty solid staff of teachers that are salaried. That's been a big change. When I was there, like, it was myself and sometimes one other teacher, and we were definitely, I made a very small salary and we got by hourly, and anyways, times have changed, and it's cool to see that all these salaried employees. But it's really hard. And we want to keep our teachers, we want to keep all of our classrooms open, but
we have
we're
really
just-
small like really good ratios, which I think
Mhm.
all of our families benefit from, our kids benefit from that, and it's really appreciated.
Yeah. Yeah, so we're just in this hardship where we're trying to figure out what to do. We are trying to raise about 100,000 so that we can get through the next fiscal year. We're going
To donations or?
through a variety, and I can share with
Okay,
you.
you don't need to break it down.
No, it's really important because I mean, and a lot of these things are like, we're in the middle of asking, we're in the middle of figuring it all out.
Yeah.
We're exploring an option with like a scholarship fund through the American Legion. It's a big question mark right now, because typically that money goes to college, high school graduates, but we're like, well, let's think about these little graduates first. We'll see if that comes. Today I'm really here thinking about TANF reserve funds. Requesting 25,000. The Silverton Public School so far has helped with 10,000. And then they're going to help with another 5,000 to pay for, it's under staff retention to help pay for teacher salaries. And then again, with the lodging tax application, we're really hoping to just be a line item in the 2026 budget. I put down a number of 2,085. That would accumulate to 25,000 if I did the math right.
Say that again.
Thinking about the lodging tax allocation for a month, per month, starting in 2026, maybe around 2,000.
Okay.
A month. That's just kind of a number that's out there that would get us, by the end of next fiscal year to 25,000. Maybe it could be more, maybe less. I mean, I know that you guys have to also think about your budget, so I'm putting it out there now. We're also requesting funds from the town. Gloria recommended we ask for 40, and maybe we'll get 20, maybe we'll get 25. We don't know yet, but we're throwing things out there. We need all the help and support we can get. Yeah.
So again, this, this is just to keep you guys alive. This is not including the boiler or anything else, or where are we at here?
Thank you very much for your support with the boiler, and that
Okay.
is done.
It's done?
Yes,
It's done?
yes,
Great.
yes.
Oh, that's
We're
awesome.
back in state, Dave.
Cause it was a now problem, you guys,
Oh, yes.
good,
It was a huge, it was a very big problem.
so that
And
10,000
It
helped.
it was very helpful. We're
Okay.
so grateful for you. In fact, well, there's a thank you note for you somewhere.
Oh, yeah, we wrote a thank you note. Yes, back to the learning center.
This is,
That is okay.
this is
We don't
different,
need to
yeah.
thank you, we're just glad that.
Yes, no, we
Yeah,
appreciate your
Yeah,
fast
that-
action. and
That wasn't a winter
fast
problem, that was a
action.
now problem, so, good,
It was, yeah.
Yeah.
Mhm.
a water problem.
Yeah,
Right?
Yeah.
Dave got right on it,
That was amazing.
he came in under budget. And his budget was
So,
way
so
under.
with all the kicking and screaming, he
some
he
of
came
the-
through,
He did, yeah.
God bless him,
Well, good,
good,
on your guys'
Enough said.
part, great,
good,
great work to,
good. Dave's a good guy,
He really is.
Yeah, he's,
really good.
anytime we've had a boiler issue, he's always been the one to jump in and deal with it. So
I
I'm
mean-
really glad he was able to get it.
And you notice the price difference between him and other folks,
yeah, the other quote was
Keenan's
25.
25 grand.
Yeah.
Yeah, David.
And I'm sure
very
that,
reasonable.
I'm sure that required
More than
replacing the whole system and not just the boiler unit itself, but still,
Mhm.
it doesn't matter, it wouldn't.
It wouldn't have been
It
affordable.
wouldn't be fixed now, and it would have been much more expensive, so,
Right,
yeah,
Mhm.
good, that's awesome to hear, that's done.
yeah.
Yeah.
And we are, there is a green grant. We wouldn't be able to apply for it until November, but we did reach out to them. They said that like maybe that could be reimbursed. So we'll apply for it if we can be reimbursed and give you guys that money back.
Mhm.
However that could
Yes.
work out. Yeah. Yeah. So I mean, some of the, yeah, this funding is really to just hire and retain our teachers and our staff. Continue to be a licensed early childhood facility, help bridge the gap that Universal Preschool Program has created. I mean, originally I jumped back on to the SFLC board because as a parent with 2 young children at the center, I mean, tuition rates rose 30% 3 years ago. And I found myself like really struggling to be able to afford childcare. So that's the reason why I joined the board. The previous president, they moved out, I was ready to, and now here I am, but like the big thing is like, we want to keep tuition rates low, we want every child in Silverton to be able to use this facility. And we're just in this like dire situation. On top of that, just full transparency, our Debbie, our director, who started in June, she has already resigned. I discovered that was on Monday, so like it's pouring on us.
Wow,
Yeah, we do have a really strong dedicated board that,
Mhm.
I mean, we would have had to shut down like really end of May if the board didn't come together and try to work things out. So it's just kind of been one thing on top of the other. Yeah. And here
so
we are.
what's the ask tonight? Sorry, I just wanna cut to the
No,
chase, yeah.
no, well, no, and I
mean,
have,
or is
Me
this,
too.
is this, you're talking about lodging taxes and
She's,
budget numbers, or what are you doing?
she's gonna ask for 50,000 in TANF funds, hoping that we give them 25.
yeah.
They're asking for 25, that's what.
25.
I was just trying to get you
Yeah.
the
Yeah,
meat of
let's
it,
get to it,
yeah.
yeah.
Yeah,
You don't have to hear my sob story anymore.
yeah, no, I appreciate what
sucks.
you're going through.
And really kind of like, I'm putting it as 3 parts. So yes, the TANF reserves funds, 25,000. Martha and we've had a meeting, it was a couple weeks ago. Then we met with Willie too. The other is just county tax, the lodging tax allocation.
That's an earmark, that's an
Obviously-
earmark in the budget, right?
Yes.
Okay, gotcha,
Asking
Gotcha.
for that.
yeah,
Yeah, and that,
Got it, yeah.
that'll be something we determine when we when we do the
Do
budget.
budget.
Mhm.
But I
Totally
I
agree.
know that that's what they're asking for.
Okay.
And then I loved this idea, Willie, when you mentioned it, and I don't think it's up, not for this, but for the 2026 ballot. That idea of raising the lodging tax percentage, maybe by 1% more, and really allocating it for childcare. Funds could be used for childcare only. I know it can't happen on this ballot, but I'm like, if we could really work together and figure that out and really campaign for it and have the right wording, I think that would really help the learning center just be more sustainable.
Mhm.
And these asks are not for a sustainability plan, like this is just to get by so that we can stay open and operate.
If, if. If all these asks come, I mean, the 25,000 and the money from the request to the town,
Mhm.
and if you get stuff from the Legion. That'll, if I understood right, that would fund you. For this fiscal year, your fiscal
Yes.
year, so we
Yeah.
could,
Like
and
it was off.
so.
And yeah, I think to Pete's point, we have right now an emergency funding plan, which we're hoping that includes these TANF dollars. That is our main ask for you tonight. It's the money we're asking from the town. It's the money the school board has already committed to us. Your assistance with the boiler. And then then we are, of course, knowing that if people are gonna show up and support this emergency funding plan, they want to know we're going to stay open. So Willie's idea for a potential ballot measure or being a standing line item for you guys, that's us thinking long term. So we want to fix this need, but we also want to assure you that we have our minds to the future too, that would be a good investment for you all. And I wasn't part of Natalie's meetings with Martha, but it's my understanding and that these TANF reserves, this request is in the spirit of what that money was collected for. Those are social service funds, and this is a very essential social service.
Looks like Martha wants to say something.
Well, I just felt like it was rude to just be a black.
Oh,
We've been having internet problems.
oh,
Oh no.
I jinxed it.
If Dennis, if you can hear us, let us know.
It just happened over there.
Probably on our end
No, I
again.
don't see that.
Yeah,
Yeah, freezes there. We're
it's on our end, it's not on our end.
No,
Oh.
you're good.
Oh,
You're good.
Dennis is here.
Yeah, I think it's Martha.
Okay, all right. Sorry, Dennis, but
She was
That's
present.
all right.
yeah, but you guys can keep going. You have a TANF funds if you'd like. We understand, we've tried to keep that balance as the TANF reserves high in the event of a rainy day, and I can't imagine a rainier day than this for better use for the rainy day fund than this. Unfortunately, in the past, we were able to kind of buy TANF dollars from other counties at a fraction of the cost. So like last year, but this year, we were able to keep our 100,000 TANF reserve, which is the max that the state allows us to have, by purchasing TANF reserve from another county. And I think we purchased, what was it?
10,000.
10,000 for $1,000. So that was an investment that the commissioners made to make sure that we kept the balance of our TANF budget as high as we could. Oh, welcome back, Martha.
Yeah, thank you. And that was my fault, not yours. So, so I know I missed a couple minutes in there. And yes, I've had the conversations with Natalie and with the commissioners, and the TANF reserves funding absolutely meets one of the purposes for TANF reserves. I've talked to people at the state also to make sure that we would be okay using those funds toward supporting this learning center. And we absolutely can do that. As I know I've talked with all of you about, it's not sustainable because once they're spent down, they're spent down. But at this point, certainly the $100,000 we have in there, 25,000 to support the center while a longer term plan is worked out is a really good investment in the children and the families and the town of Silverton. Because if people don't have care for their kids, there's a lot of things they're not able to do. So I just wanted to put those pieces in since Natalie and the board have been working so hard to make this work.
Thank you, Martha.
Thanks.
Yeah, so, I mean. I think we all understand that TANF funds, aren't there forever for us and at this rate of contribution, but, as we develop a better longer term strategy and, work on ballot initiatives and things like that to get forth, I think it's helpful. And honestly, I don't see a situation in the near future where we'll be able to purchase TANF funding from another county again right now. But for that same kind of thing that we've had to before, so we'll maybe have to climb our way back up the hill to get back to our max rainy day fund. But I mean, it's an attack on education that we're seeing, I think, on a national scale, and I think this is well worth the investment of those funds. Pete, you got? Oh, you're looking at me?
No,
I wanted to say something. So
Well, I'm looking at what our next step is here. I
Yeah.
mean, I've heard enough, and we know your situation. I mean,
yeah,
you're trying,
yeah.
and you're planning and you're doing donations. You're going at it every angle you can.
Yeah,
We're able to do this again if we.
and I think this year we were able to waive the payment that Silverton Family Learning Center makes to the cost of the building.
Yeah, and that's such a big help too. We're so
Yeah.
appreciative
So-
of, we know you guys are really doing everything you can for us, and it is, we really appreciate it.
But that building isn't paid off until the end of next year, is that correct?
Got 2 more years.
2 more years.
We've got 11,000 employees.
Okay,
Left.
and we had
That'd be
discussed.
nice.
We had discussed just paying it off at the end of this year during our budget season, and obviously that may not happen. We would rather give you guys, rather than pay that $11,000 off, we would rather you guys have that money to continue operation. It's only a couple more years, and I think we can probably squeeze that $6,000 a year
Yeah.
out of our budget to continue to add that into that contribution or savings, I guess we would call it at this point, probably, rather than contribution. But I think that's something we can definitely work with. And I think, as far as the budget request, I think we're gonna have to go through our full budget before we do final commitment, but I think I think a reasonable good faith commitment of $25,000 is very reasonable ask.
Okay.
And when we get into the deeper budget discussions, we'll see how much more we can kind of carve out there and work with some of the other folks for affordable housing, because that initiative was divided, or that use of that funding is divided between affordable housing and early child care, and I think that amount is a very reasonable request, and I'm hoping we can commit more, but we'll have to probably see. Does that sound fair to you?
I think
Okay.
that's a reasonable request, and I think,
Yeah.
I mean, we just have to look how the numbers.
Yeah.
Line up in budget, but
Yeah.
yeah.
That being said, we did just discuss our resolution for this ballot measure. Very important for funding some of these extra funding requests that we're having right now, that we have your guys' support on that ballot initiative too. And you know, we can work with you guys a little bit, but as our attorney reminded us, we're not allowed to directly campaign for that funding.
Yes.
And that funding would be really important, I think, for being able to continue to support funding initiatives like the daycare and the next funding request that we have on our agenda as well. So
Right.
yeah,
Totally.
it matters for all of us, and it matters especially for the learning center and for our community. So we've maybe help us with that initiative.
Sure. Yeah.
You said that well.
Okay, thanks. Yeah, I didn't get shocked by Dennis, so hopefully I wasn't out of line in advocating for some help.
Can you help us understand your timeline for when we might have a firm commitment with just the TANF funds, the 24,000 there, or whatever it ends up being?
I think TANF fund, actually, maybe we should have Martha speak to that as far as like strings tied for TANF funding, but I don't think it's a budgetary requirement for this year, is it?
That's correct. Last year, I worked with Willie to do a budget amendment, and we can do that again for 2025 with unexpected, essentially, revenues and expenditures. So it would be fine if you want to approve the $25,000 in TANF funds tonight. And then I can start working with Natalie and the board on developing the contract, because those funds are paid on a reimbursement basis. And so we have to have the contract in place before we can reimburse any expenses. So the quicker we can get going, the better it'll be to be able to extend it more through the year. The TANF year ends June 30th. And so then we could certainly revisit if we need to at that point, as far as looking at funding again for July through June of the following year, or if the full 25,000 hasn't been spent, we can do a extension on the contract. So just to give them more time to have some work getting people paid, we could do this right away.
I mean, and I do suppose, like, in the lodging tax funding, approving 25,000 tonight out of lodging tax funding now versus the first of the year, there's not a huge difference there, is there? Other than not having our third commissioner, who I would hope would support that as well. Just does that make sense to approve a $25,000 allocation of the lodging tax this evening as well, or would you rather prefer to see that in a budget
No, we
section?
should do that.
Yeah, it's budget time.
Okay, all right.
And then do we need to, when it is budget time, like, do you want us to come back and talk about this again?
Like line number 2?
I've got it in my notes, so I will put it in the budget as a request, and then if, depending on how the numbers work, if we need more from you, we'll ask you or.
Because your fiscal year's January, right? January to.
Yeah.
Okay.
Yeah.
Okay.
So, yeah, we're.
So then we'll touch base then like November-ish about it? Okay.
Yeah, we hope to kind of have our budget firmed up, in November and then approved in December.
Yeah.
But yeah, this is your budget request meeting here for that, and you don't necessarily need to come back to us to do that, unless something changes for you guys. And we definitely would want to hear if that.
I mean, if we put out the draft budget and we decide we're gonna pack you entirely, then you can come to the public hearing and en masse and scream at us.
Yeah.
They're all of our crying babies.
Yeah.
We had quite a meeting one time there.
Yeah. Poor Pete was the only one here.
Yeah.
Scott now runs it. One way too, but yeah.
Yes, yeah.
But yeah, I think those are reasonable requests and reasonable goals, and I'm so glad to see you guys, make.
Do we need a motion on this, or do we?
Yeah.
For the TANF funding, yeah.
For the TANF.
Are you entertaining the motion?
I'm entertaining a motion for, to approve $25,000 of, TANF reserve funds for the use at Silverton Family Learning Center.
I'll make that motion.
All right, I'll second. All in favor?
Aye.
Uh,
Oh my gosh, that's a relief. Thank you guys so much.
Yeah.
Yeah,
This is huge.
I haven't been sleeping much because of this.
Oh my gosh, this is great. We really appreciate it and
And if you're curious, like I have copies of our emergency funding proposal. I'm happy to share it with you digitally or however you'd want it. And any information that along the way that if you're curious about. Or if you wanna go through the archives.
Yeah.
Let me know.
All right,
oh, thank you so much.
I'm sure Willie wants to see the electronic copy and he can distribute it to us. That's probably the best way to
Yeah,
go.
I've shared a lot of this with.
Okay,
with
all right,
everybody,
good deal.
but,
All right.
keep us in the loop as far as, interim directors, process, whatever,
Yes,
funding, I mean, just
Yes.
keep us in the loop so that
definitely.
we know what's going on and we don't
Yeah,
hear stuff on the street so much that, we know what is right happening, we can keep the.
I guess I gotta ask, you're hunting for a new director?
yeah, well, we're kind of taking a step back and we are trying to think of, just how to get our organization, just all of our ducks in a row and really, kind of breaking up huge piece of the directorship and some of our board members are maybe not going to be board members anymore and like Lacey might take over like being the finance director.
So,
Kind of
board's
dividing
more
up.
active in the.
We're trying to distribute it amongst,
Got it.
luckily we have these stakeholders that super care. And we found that our board has been able to do some of the director duties. We didn't really want to find that out, but we did find that out that luckily we have that kind of board. And so I think just in this time of hardship, we need to use the stakeholders that are super committed and
Good
wait till this
Good enough.
position that someone will, can run with
Step
and
up,
have a lot of
yeah.
success with.
Okay,
Yeah.
good enough.
Mhm.
Thank you, guys.
Thank you.
Thank you.
Good luck.
Yeah.
Thank you.
Yeah.
All right.
Thanks, Martha.
Yeah, thank you, Martha.
Yeah, thank you, Martha.
I have to collect this historic document.
Please.
Yeah.
Yeah, I meant to hand it back to you, I didn't want to interrupt the flow. Yeah, come on in.
You guys need me at all? Do you need us?
Oh, I know that's.
Essential.
Thank
Right. Can I come on? Thank you.
you very much. Yeah. All right.
You guys.
Thank you.
Becky?
How are you?
Good, how are you?
Great. Thank you.
All right, and I guess I'll say this kind of while these guys are in earshot, but we did have a meeting with the town of Silverton.
Okay.
And we discussed, kind of some of these funding requests that we're having and asked for them when they look through their budget to kind of examine what they have in terms of support for some of these requests like Silverton Family Learning Center and also and high country remote care. And so that we can kind of talk about community success and partnership and in making some strides towards achieving the goals here. Because
Good.
as much as we wish we had the funding to just say yes for everything, we're financially for the county in an okay position, but what's happening to us is that all of our sources of state and federal funding, as Becky is well aware, are starting to dry up and in a way that, we anticipated the funding from COVID to go away, but we didn't anticipate, some of these long-term funding initiatives that we've had, like secure rural schools and PILT money and things like that to kind of start taking.
We're having the
Taking a
same thing
dive.
in primary care. It's
So-
called Primary Care First, which is the biggest value-based care program in the country.
Yeah,
It's been keeping practices afloat and they cut it a year early. And a lot of practices around the country are on the field.
yeah,
So, yeah.
yeah. But yeah, please go ahead and what you guys got.
Sure, just want to give you a quick update following our meeting on, I think it was the 21st of April. Mostly around the patient volume that's, we sort of anticipated was gonna happen. I think back then I mentioned about 20 patients per week we would be seeing. We back at that time, we moved up to 11 per week. We're now back to 21 patients per week on average since the end of April. And that represents actually from the beginning of the year about 25% weekly growth. And it kind of goes all over the place. Sometimes we have less, but we had a outbreak of flu in I think it was May, and we saw 33 patients in that week. So the other driving factor in this, actually through the month of August, is pediatric growth is happening now.
Great.
75% growth in the month of August, and those patient visits. And that's going to continue, I believe. What hasn't really affected us too much yet, but I know is going to hit us very soon, is the Innovation Medical Group and then Silverton Clinic closures. So we have been taking on some of the Silverton clinic patients. They're going to continue, I think, trickle in. But I've also talked to Deanne about having another ad in the paper, just sort of a state of affairs, like what, where we come in the past 9 months in terms of high country remote care. And we're going to start marketing more heavily to the entire community and bring up awareness about, we're still here, we're thriving, and we'd really like to start, getting everybody in town on board in terms of wellness visits and so forth.
Yeah.
What's been really, really helpful and made our transition not seamless, but close to seamless, is the partnerships we've developed with Public Health. Becky's been phenomenal. Everyone's jumped in and helped. EMS, we've partnered back and forth with some pretty sick people. And there's been no sort of hesitancy in there. Emergency management, the Silverton Public Schools. We've had episodes of like, not just flu and COVID, but the measles outbreak. So it's sort of disciplinary approach to trying to make sure that we're ahead of the game if we had anything arise in the county. And it was better than what I've seen elsewhere. So it's been very wonderful to work with everyone in town here. The other couple of major things that happened when we launched, we slowly trickled in all of our insurance contracts. One big one surprised us. Healthcare Rockmont Health Plan. There's a group of the folks who have purchased that online through the marketplace, and they denied everything, and that happened for months. Trying to get through to United Healthcare to get a question answered is virtually impossible. They've implemented chatbots, and that blocks you every corner. So I spent hours and hours trying to talk to people how this could be fixed. And the response was, when I did get to talk to somebody, it couldn't be fixed. Talked to Dana, mayor, a few weeks ago. She made a call down to La Plata Public Health Department. That morning I got 3 emails, one finally from the CEO of Rocky Mountain Health Plan. He apologized and said it was a screw up. The vice president would be calling me. He called me about an hour later. They never got my contract across their desk to sign. So they turned around, gave me the contract, signed it. All those claims for the past 9 months have been dropped this week. We're retroactively, so they should be able to be covered. So basically,
good on her.
yeah, it was big. So we've held up on all those bills. Nobody's gotten the bill. No one's been sent to collections. I haven't taken money from anybody for any of those. People keep on dropping in checks. And so I'm anticipating that those are going to start to clear within like the next month. But that was big. That was working together was, that was really wonderful. One outstanding contract that we have is a VA. I don't know what to do there. That went in January. We would hear from them every month. We heard from them last week. They're in a process. That's all we got. As soon as that comes through, I think that's going to also up our volume considerably. Because I believe there's at least 50 vets that have found.
Almost 60, I think.
60.
Yep.
And the day that opens, we'll start pulling them in and get them under our system here. Okay, so that's sort of some updates. The next page just basically shows volume. and how we've been growing. I think the most important one is the average weekly visits is at 21. We've had and that's been growth through the summer despite summer's traditionally being a lull. We had a few people from the folks coming in for the summer who visit, but between some of the peds add-ons and then some of the getting word out, and then some of the Silverton Clinic and Innovation Medical Group, that's kept us growing. I think in the next 3 months, there's going to be significant rise, and we'll be at 30 per week by the end of the year. And that's kind of conservative. It depends how sick people get.
Yeah.
So we're thriving right now on primary care, mostly not urgent, but as soon as the infections start to come around and so forth, we're going to see a significant rise.
Yeah.
And that includes all the kids at school. So when we look at our clinic capacity, we have a certain number of days that we're open officially on the schedule. We see patients all the time. They call in, we triage them, and we make arrangements to see them somehow. So we've steadily been climbing in the number of off-hour visits that we've been seeing patients. We're about 72% above our online based our scheduled capacity.
Yeah.
With all of that brings a heck of a lot of additional work. Chasing on all the insurance claims, following up on labs. We have probably quadruple the number of faxes we get in per day now from back in April. All the follow-up referrals, it's a lot of work. At some point, the wheels aren't coming off. I'm now working 7 days a week. My Sundays are pretty much catching up. I still have time to go fishing now. So I'm not stressing too much. I fish, many days out of the week, but I see this also growing to the point where I'm not going to be able to keep up with all of the back office work by the end of the year. In addition, I'm jumping ahead, but the pediatric the pediatric visits are going to probably go up significantly. We're working with the Silverton School district to start a school-based clinic. So the kids don't have to leave the school to come over to the clinic. So Yvonne, being a pediatric provider over there, is seeing a lot of sick kids so far that would traditionally have gone home and then had to make doctor's appointments and be seen whenever they could get in. And we talked to Elizabeth, and the attorneys are writing up the agreement. We're not going to pursue the grant route. That's going to take forever, and we don't need it in that sense. A lot of this is basically shifting some of our workflow, just to a different place of service workflow. So that should be ready in September, but there should be a functional clinic in the school that is also going to get us very busy very quickly. A couple other items of what we were projecting between now and the end of the year, aside from the clinic from the school. We're definitely putting the word out on more primary care, preventive care issues, child wellness visits, Medicare wellness visits. We started a program called Advanced Primary Care Management, which is a Medicare program that allows us to manage patients behind the scenes and get reimbursed for it. That's a new thing, is they've been cutting our reimbursement by 2% every year. This is to help fill the gap, and we're identifying certain Medicare patients that qualify for that. That's going well, and that's going to continue to grow, but that takes, again, a lot of work in the backside to make sure we're checking all the boxes that Medicare requires. After the first of the year, I've started the process of establishing what's called a patient-centered medical home. And that's a Medicaid program that allows us to dip our toe in the water, what's called value-based care. So we can identify Medicaid patients and start getting paid on a per member per month basis. It's a lot of work up front. It's a good first step towards a federally qualified health center. So we start checking the boxes as a patient-centered medical home, and we're following the rule book. We're covering a lot of bases for the next step, which we talked about in April, would be a federally qualified health center, which is a long-term hope for a sustainable healthcare system in San Juan County. Let's see. just mentioning, we have some physical therapy in town. It's not really associated with us, but we do have a person working in that sense that we're starting to send a few patients to. Dental services are returning to town, it sounds like. What we are missing is home health. We're kind of winging that. That's a formal program that would be very beneficial to establish. You have to qualify and check the boxes. There's a heck of a lot of home visits and wound care being done behind the scenes of folks that aren't getting reimbursed and basically volunteer type services. Let's see, kind of just moving forward, talking about what it's going to take to provide this. We have had someone helping in terms of medical assistant, which is, that hasn't gone as we thought it would go. But we would like to have a role, actually, two, part-time roles. Would like to fill one of those roles between now and the end of the year to help capture or help, with this volume that we're see coming down the road. And then after the first of the year, have two roles, so continue the initial role and then have an admin role. Both would be part-time because the best thing you can do for a clinic is cross-train the folks. And if one leaves or one wants to go on vacation, other one can jump in and pick up the slack. So I think the last time I talked about a single role, but I've kind of changed my thoughts on that in the long term. What would be extremely helpful to get us through the end of the year would be around $12,500 to cover a 20-hour-a-week medical assistant. We have the person identified already. They're well-trained. I think we're very good. And after the first year, we'd like that person to continue and then possibly find the admin person that can really help with the heavy lifting as we start to evolve towards a patient-centered medical home. Lay the groundwork for the Fairly Qualified Health Center in ballpark in 2027, and really keep up to date with all the building items, contracts, and so forth, and maintaining our credentials that if they go awry, things shut down quickly. But that admin spot that I'm doing right now is going to continue to get more time intensive and complicated, and we're going to need some help after the first of the year. So. Any comments or questions about anything?
So the ask.
I had a,
Go ahead, Dennis.
yeah, in your documents, it lists nonprofit setup and operations. What is that?
I think, are you by chance looking at the previous document from April? I took that off of this item.
Did you email this to them? Because otherwise you don't have it.
I just emailed, I forwarded him the email you sent me.
I wonder if that PDF actually had, Dennis, the relevant pages are actually pages 9 through 13. I may have accidentally attached the original full document to the email.
I'm looking at page 5 of this requested funding. And
oh, geez,
yes.
Sorry about that. I see. Okay, no, yes, totally erased what I just said. That's January forward, and that would be back to the concept I had in April, would help prepare for the Fairly Qualified Health Center, which is required to be a nonprofit. And so I just sort of ballpark that. I have talked to local attorney about who has experience with setting up nonprofits and sort of ballpark what that might cost in terms of the work and so forth. But yeah, that's related to the Fairly Qualified Health Center planning.
Okay, I was just curious. And then would that be so would you be running two entities at that point, or would you merge this into that nonprofit?
It would be two, preferably, unless there's a disadvantage of that. Worked we own a clinic in Washington. I had a company that was for profit, and I was contracted to the hospital, which is nonprofit. And basically, the hospital handled the operations, inventory, and so forth, the staffing in terms of nursing. And I was the contracted MD, and that was fairly common to do that in a nonprofit or healthcare organization. So I just consider that would possibly be a good option where a FQHC could be set up, a lot of operation and staffing could be under the nonprofit. That also opens up for grants and other types of funding. And the actual medical providers could be contracted in separately.
Okay, fair enough. Appreciate it.
And Becky thinks.
I was looking forward to not saying anything.
Too late now.
I talked to Becky today, and she thinks that you've got some funding, some state funding that would cover this 12,000
6.
through the 12/6 through the end of the year, and that basically their ask qualifies under one of her grant programs.
Yeah, if you look at number 5 down at the very bottom, those are foundational core public health services, and we do receive a set amount around $91,000 a year for core services. So at the very bottom, those are the foundational services. And sorry, Dennis, I don't have that for you.
It's
I can-
okay.
Okay.
Yeah, it's
Yeah.
it won't flip around and be so.
But it's, there's foundational capabilities, and then at the very bottom, it's number 5, access to and linkage to healthcare. And so I triple checked with our manager of that program at the state. And we fall under this collaborative efforts around access to clinical care for this funding. And it essentially, to paraphrase, as long as it goes towards the planning to improve healthcare quality and effectiveness, reduce healthcare costs, and improve population health. And then it goes into the primary purposes to assess healthcare service capacity and access to healthcare services. So all along, I felt like this reduces barriers to access to care. And so as long as we report it in a certain fashion and do a little bit of a budget revision, then we're able to fund this. And a big part of our position with this is referrals. And I reassured, this manager of the program, I said, all we've been doing is referrals. This is what we do all the time with this medical group. And I said, we've been doing it so much for so many years with any primary care provider here that's almost up there with vaccines for us, is just linking people to access to care. They text, they do whatever, and it's great. And we can say, yep, this is how you find them. This is how you do this. This is what you can do. It's open tomorrow. It's open here, there. So with the Silverton Clinic leaving Friday is their last day, and then they're going to still operate for a couple more weeks. I just checked in with Terry yesterday. But with them leaving, with Innovation pulling out, what was it, a month or 2 ago, this is just, I feel, more important than ever to incentivize and to assist and to help as much as we can to provide, as you all know, probably very, very high functioning medical care here. So.
And could I add something?
Mhm.
I raised issues at the last meeting when we talked about government funds being provided to private enterprise, and it is allowable under what's called the public purpose exception. Generally speaking, the government's not allowed to, the county's not allowed to fund private enterprise, but when primary purpose is public function, and this I think falls squarely in that. You can't gift money, but if it's providing such as serving or promoting public health, safety, or welfare, that's the primary purpose of the funding. Then you I do feel even more comfortable when we have a category in public health that specifically addresses public health care like this, or access to health care for the public. So I feel comfortable that the county is certainly able to go down. So then the other thing I touch upon with the clinic leaving, the clinic was, or our master tenant, so to speak, of the miners, and then they used to, or they did sublease out to other medical related providers as well, people that use the space alongside of them. Um, maybe not every day, but some days of the week, or when they came up in the month and so on. So I think what we'll end up doing is probably taking over all of the leases and having with all medical providers instead of putting that burden on Dr. Brown. We'll just address that on our own, and that will also allow the county to determine who they feel like would benefit the public, uh, should be allowed extremely low rate, if not free, office space to do so. That's all I have.
All right. I think we've spent some time discussing and trying to, iron out some things. That one of Dennis's concerns there, was just making sure that we can find a mechanism for the county to be able to fund a for-profit entity in terms of healthcare. And yeah, that's great news that we have a leg to stand on to do it. We have kind of done it in the past. Willie's kind of mentioned that we have paid doctors in the past to come and provide healthcare services in San Juan County, but of course we want to stay within the bumpers as best as we can to make sure that we do it. But I think that this has tremendous potential to benefit every member of this community. And I see healthcare as the number one issue of our generation. And I see the regional areas access to primary healthcare and healthcare options falling apart. So we've discussed this more and more with the lack of federal and state funding, that we need to find ways for our community to support initiatives like this, and to support the things that are really important when other things are drying up or blowing away, or however you want to say it. Same as the daycare, I think for that $25,000 request that they had, we said tonight, we can't definitely fund that, but we can definitely say that in the budget that this is a top priority for us, I think, to make sure that we set you guys up with the tools for success, and that we try to support healthcare in this community, because I think it's the number one issue nationally, but that also makes it, I think, the number one issue here. But more children coming in here, 40% of our community is now over 60, and so aging in place is going to start to impact us more dramatically than it has in the past. And I think it's just really important for us to try and do what we can. I think that we definitely need to have some talks, Becky, about this core public health services, for how much we can pull off of our ability to utilize that services, and then also leverage public health position in the emergency services funding, to see what kind of things we can come up with. But considering that public health hasn't really come to the table for emergency services, asking for large chunks of money in the past, I don't see that if we work together, that we won't be able to come up with this number.
Thank you.
So that's my perspective on it. Willie, what?
Well, I think.
Yeah.
That being said, I think, give them the same speech that you gave the preschool,
Yeah,
we're putting an issue on the ballot in November
yeah,
that takes the limit off of. The statute was just passed that limited our increase in property tax revenue to 5.25%,
Okay.
which will cost us the first year about $85,000.
Mhm.
What we talked about was preschool and healthcare are a couple of important items to us that $85,000 could be used for, so.
You know,
and literally this request and the preschool's request is about that difference. So,
We got together and talked about that, the
yeah,
preschool one.
yeah,
So,
but
yeah, so, yeah, it's just something,
Okay.
you know.
but just we would ask for your guys' support in that ballot initiative because we are not allowed to campaign
Got it.
but we're not campaigning.
ballot initiative. It's important to our community,
Yeah.
to retain that funding to be able to support programs, to support, access to healthcare, to support our family learning center, and it is important to us that ballot measure pass so that we can support these things. Where the county we're in an okay financial position as far as like our property tax and our regular revenues, but we're seeing a significant decline in our federal and state partners, which is a big reason why, the preschool is coming to us with a $25,000 or more request of funding. And so, yeah, if your guys' support for that ballot initiative really matters for these requests. And so anything we can do in the community to kind of rally support behind that measure, because it's going to be on the ballot and it matters to all of us here. So,
Okay.
yeah.
Okay. That's greatly appreciated.
Yeah.
You guys are supported and, both, emotionally and, financially and so forth.
Yeah.
Question, this is my, operational mind setting in. If the funding comes available through the end of this year, I hire somebody. And then it doesn't come through in 2026 for some reason,
Yeah.
then I'm letting somebody go.
Yeah.
That's a bit of a disaster waiting to happen. I'm throwing that out there.
Sure. Yeah.
Because we're gonna build this up.
Yeah. We do.
It's gonna be robust.
Yeah.
And I'm not sure I'll be able to handle the whole thing through 2026.
Yeah.
With hours it's gonna take.
Yeah.
Yeah, I mean, I can definitely do what we're doing right now, but I just know we're gonna grow.
Yeah.
So, okay. But,
Yeah.
Dr. Brown?
yes,
You're fine, and you understand right now you're a subtenant of the clinic. And so then, we'll be putting a lease together, to take you off as a subtenant, just make you a tenant of the.
that's from what I understand. I talked to Becky some today. I don't see the upside or the downside one way or another, to be honest.
Well, you were subject to all the terms of the lease anyway. It's just that you were listed as a subtenant. You were just sort of secondarily. So if we do it this way, then you also don't have to be responsible or liable for the other providers that aren't related to you that go in there. So this certainly you should talk to your attorney if you have any questions about it. But you're going to get a lease that looks a lot like the minor's lease that you're already obligated under. Is what I'm telling you.
Okay, yeah, no, that's, I appreciate the whole lease situation. It's unbelievable. So I think whatever works best for the building and for the town.
Thank you.
So from the financing standpoint of this position, and it's the nature of the beast. I mean, Becky's got money in the bank right now, or not in the bank, but pretty much in the bank. So, we know we're good. We will be starting our budget process here shortly. We won't finalize it until the middle of December, but we'll have a pretty good idea usually by mid-October, early November as to where everything's fallen. I think we've got, you know, I mean, depending on what happens with the ballot issue, you know, that's potentially a chunk of money. We know we've got some money in emergency services. What we don't know is where, you know, what money of it will be available out of public health, just because, you know,
We're working on it.
yeah, just because of the way the financing is going for public health, you know, that money that's available this year, next year may need to go just to maintain, you know, Becky's office kind of thing. So, I think, I mean, and I can't speak for the commission, but I think there's a pretty good shot that at a minimum, we'll, you know, we can keep the, you know, the $12,000 person
Good.
online.
It'll be more than that in there, but
Right,
yeah, but you're saying,
position number one.
position number one,
Be any layoff.
we can,
Yeah, this is a, yeah, this is
Well,
a top number.
We'll have a better idea once we actually get in and start throwing numbers around.
And again, I'm not opposed. I think somewhere on there I had the, you know, we'll put money back in as our revenue grows. We're okay to take some percentage and put it back in, and that can be, you know, moved, that percentage can be moved if we need to fill gaps, I think. And obviously, we're gonna benefit as the volume goes up, and so we can take some of it and put it back in.
yeah. And we talked too about like our support of the Silverton Clinic too, since we don't have that obligation to fulfill for the Silverton Clinic. Too, we will have that funding available too. Yeah.
Okay.
So, and Will, you might have to correct me on what those numbers were. How much annually do we contribute to the Silverton Clinic?
I think it was about 26,000.
26,000.
So we've got some,
Right.
you know, we've got some money there as well.
So that funding, and then the Silverton Clinic this year, or is there gonna be, you know, is that 26,000 committed to the Silverton Clinic this year, or will we have some of that funding?
It's reimbursable, so
Okay,
obviously, since they won't be continuing to the end of the year, we won't spend it all, so some of that will go back into fund balance.
yeah.
So
it's
I
not
would
bad.
ask if there was a decision on the 12.5 or 12.6, that would sort of be known ASAP, because by the time I get the person hired and trained and up to speed,
Sure.
there's probably a month of that before they're actually rolling and doing the job. So that'll put us into October and so forth, even if we were hired in September. But just sort of keeping that.
And again, that decision could be made tonight with the motion of the commissioners.
But we had talked about using this core
Right.
public health
Yeah.
service funding.
Yeah.
So we have to approve that as Board of Health tonight, or do we have to have our Board of Health convene separately in order to approve that funding?
I think we just convene as a Board of Health and make a motion.
Okay, all right, we can do that.
Dennis, what do you think?
You don't have a Board of Health meeting noticed for today. So I would be a little concerned about that.
Actually, it's a county budget.
I was gonna say, I think it might just be a
Yeah, we
county
just
budgetary
go to
item too.
Board member,
Again, I wanna make sure I
We're getting
keep
a
us in
pretty heavy
bumpers here,
protocol here.
that we're not flying off the track.
Dennis isn't comfortable with that either.
You're not, okay. I mean, we can notice a meeting and convene and vote and re-vote on that for sure, if that's what it comes down to. I don't think that's a big deal.
so Dennis, you're not, we can't just do this as a board right now? You're not comfortable with that?
It depends if it's definitely coming from the public health budget, or if it's coming from some other source, or you could do a motion by this board to locate a funding source to provide X number of dollars to this cause, or something like that. And then when it came time to actually allocate the funds, we'll probably have another meeting by then, and we can make sure the Board of Health, if they need to be involved, can vote on it.
Okay.
Is that what you're asking me?
Yeah, and that's a pretty acceptable way of handling it, hopefully.
That,
Yeah.
that would be the ability to talk to the person and say, hey,
Right,
get ready.
get them my.
Yeah, right, so,
Yeah, so I guess the way I would, and
You're-
Dennis, correct me on this if I'm off base, but the way I see this happening is you can make a motion tonight to approve the 12-6. And then at the next meeting, we go into
we'll convene
Board
this
of
board
Health.
health, yeah.
mode and obligate those funds from public health for that. And if for some reasons those funds aren't available, then we'll find something else.
Okay, all right,
I'm fine with that. Thank you.
okay. You wanna take a stab at it? I could do it.
Yeah, Go ahead.
I'll,
Go
I'll
ahead.
actually just, I'll just make the motion, I think. I'll just-
Yeah, we-
I'll make a motion, that we, find a funding source to allocate for, $12,600. To, fund a, MA administration, part-time position, for High Country Remote Care. Yeah, I think
I'll
that's-
second it.
yeah. All in favor?
Aye,
Aye. Okay.
there you go.
Thank you very, very much.
There you go.
Guys.
Then it just means Becky can have to come to another commissioner's meeting.
It was.
Sorry.
Really
Oh, it's not that much of a hard trip.
No, for you guys, I mean.
Well, at least, at least.
That's
you're
what
gonna
we signed
have
up
to come
for.
to every meeting or every other meeting, so. We'll
That's what we signed up for.
stop getting budget season instead and make it into.
Yeah.
Makes sense.
I usually don't get a chill on my spine, but this got one.
Good,
Very
Yeah,
happy.
appreciate it.
Thanks, you
Yeah,
guys.
thank you.
Have a wonderful night.
Yeah, you too.
Thank you.
thank you guys.
Thank you.
Paul, happy birthday.
Thank you.
Yeah.
Dessert now.
Yeah.
You should have brought cake for us.
Exactly.
All
Alright.
right, well, that concludes our appointments. So now we have, some new business, to take care of here. First item on here is the Bonita Peak Mining District, June 26th reuse site visit meeting summary.
So that's informational. We had a site visit with EPA and their contractors to look at the reuse of tailings ponds, for 1, 2, and 3. And so we watched the site and we threw out a bunch of alternatives, and they kind of go through and discuss what the pros and cons of them and
Yeah.
stuff. And it's really like that. I mean, it's kind of informational. It's something.
Was it just 1 and 2 or 3, 2? Doesn't
3 as well.
Prino own 3?
No,
Oh, okay.
no.
That's news to me.
He doesn't. No, I should say. No.
Yeah.
No, he was one.
We'll find that out in court. Okay.
No, and at least according to our class, he owns behind it, but the pond itself, he doesn't.
Okay.
But if you notice, one of the things that needed to be done was to survey the site. And so that'll
That'll do it.
that site particularly, we need to know where our property begins and his begin.
Right.
Cause I think there's,
Cause there's an access situation there. That's why I'm saying it from
Yeah.
the County Road up. That,
Yeah.
so it's in the front, so. We can hit on that, but that's,
no, if you, and again, for what it's worth, if you go to the assessor's webpage, the GIS page where you do a property search and shows the different claims and stuff, it Larry's is defined and the county's is defined, and
oh, okay.
they could be off a little bit, but basically the road just goes on, the road that goes up to is on the outside of Larry's property, and then
Right.
there's a driveway that goes into 3 that's in front of Larry's property. But we'll get a surveyor up there to set in
Get all that, okay.
and
'Cause
determine for sure.
I know there was a, yeah.
There was at some point, there was a boundary adjustment, and with Sunnyside and Larry where that property got split up.
Okay. I think it'll be an issue that comes up.
Yeah, no, and actually we talked about that.
Yeah,
When we
okay.
walk the site, is that we really need to know where that is, because,
And-
I mean, there's obvious.
and actually Athena's aware of it, the EPA is aware of it, and they're,
Yeah,
no problem.
Yeah, and nothing on that list, you know, was news to us. I think that a lot of those things were things that we've discussed.
Yeah.
In meetings before, so, I think it's just a little bit more formally outlined in writing here,
yeah.
from the discussion, so I think it's
That-
good to
yeah.
have, that.
That's pretty much, you know, like I said, the EPA contract, you know, has a consultant under contract that does this stuff, and that's, they walk the site and took notes and put this together.
Yeah.
So, and then at some point, we'll probably have, you know, as we wanna, or we decide to make some of these things more formal or, higher priority, you know, we'll probably have a public hearing or something and present them or get you know, get input on what the general public thinks are.
Yeah.
Are important, but.
Any other discussion on that?
Nope.
All right, we have a payroll processing proposal from the payroll department in Durango. To take over our payroll. Is this just informational at this point? Or is this something you want us to
Yeah,
vote on?
information.
Okay.
Alex and LaDonna have been working on this, and they've got a proposal. The firm is gonna come in and actually do
Pitch,
you know, kind of show them what they can do and how they can do it and stuff like that, but it just seems like a good next step to go to have somebody do this. It just gets more and more difficult for the federal and state reporting and
payroll taxes and everything.
yeah, and just have somebody that's what they know to do it. And you know, we're talking $4,000 or $5,000 a year, which
They take care of a lot of that.
The amount of liability that you incur by running payroll is something that, as an early business owner, I didn't really think much about. But in the past few years, with a lot of the legislation changes that we've had for the state, and a lot of the things, the withholding and the problems that they've had at the federal level for taxation and withholding and things like that, it was something that I was really glad that I had in place as a business owner, was third party payroll processing.
yeah, and there was something the other day that I'm not sure if we did it on our end or the state did it on their end, or both, but there was some confusion as to why things were the way they were, and I think Alex and Madonna spent like all morning with the state trying, they got it figured out, but it was, you know,
Yeah,
8
I
hours
gotcha.
of staff time
yeah,
to
For $4 or $5 grand,
get this.
that's all these guys do.
yeah.
Yeah,
And
from
it just-
from the private sector too, like you said, it
Yeah.
just makes sense.
The one word of caution from using, you know, different payroll processors is consistency of the person that you work with at the payroll processing is pretty important. And that every time your payroll person changes, there's kind of, you know, growing pains or learning pains for that person to learn your payroll, and you gotta really be careful that you make sure that you're doing that they're doing the payroll correctly, you know, and that you're matching it up with the same types of withholdings and things like that have been done in the past. And the other thing that wanna just ask, you know, is it a good responsibility or a good thing or a necessary thing for us to get a few different proposal quotes from different companies, or is it something payroll department in Durango is a very good reputable company to work with, so
you know, we could get some quotes, I think this was kind of the company that came up to the top when Alex was checking with other people who were using them, this was,
Sure.
they, so, yeah.
Okay. Yeah,
I was gonna add something.
sure. Go ahead, Dennis.
The other thing to just be careful of is sometimes, and I'm not singling out any particular payroll company, but sometimes these companies do, out of necessity, interpret the law a little bit, and sometimes they aren't necessarily 100% keyed into governmental differences between in payroll and so on. So that's the only thing I'd be careful of. You have to just to make sure that they're some of the governmental unique things don't necessarily cross over.
Okay.
Yeah.
Yeah.
So smart to me.
Yeah. But yeah, in general, I think, you know, having a third party payroll processor is probably a good thing for us to yeah.
I think so.
And
I think,
I'll say, in addition to, our clerk's office is ground zero for unfunded mandates. And so any, you know, lifeline that we can throw them to take a little bit off of their plate so that they can then, you know, handle some of the other requirements and liabilities that they have with the state, that's probably a good thing as well. Any other further discussion? County 150 celebration.
yeah, I guess next year is the county's 150th birthday, along with the state's 150th and the country's 250th, and so I just want to get your blessing basically on spending some money to celebrate, because we're not gonna, at least some of us aren't gonna be around for another big celebration of this.
For the 200th?
For the 200.
I probably won't be around. I probably won't be around for the 200th either.
He might be.
You were looking right at me when you said it.
I won't remember that. If I'm around at the 200th one, I won't remember it or this one.
Yeah.
I've contacted David Dibble to do a film like he did for the town,
Oh, cool.
and he's excited about doing that. I've contacted Gina about doing some
Graphic.
some proofs for you know, a logo or a graphic and stuff, and then, you know, need some banners, and want to make sure we get, you know, Road and Bridge in the parade for the 4th of July, and I mean, just really kind of celebrate it and
Sounds good to me.
have some fun with it.
I think we should make a pond with the beaver display, and we should put Louis as the king beaver in there. You can be the king beaver if you want to.
I don't want anything to do with beavers, okay?
Beavers and marmots.
Yeah.
Maybe the beaver deceiver could be in there.
Yeah.
Yeah.
All right.
Anyway.
Yeah, I think it's a good thing.
Yeah.
Yeah.
Well, grab a guard.
Yeah.
Maybe, you know, like I said, maybe if she comes up with something, maybe t-shirts or whatever.
Yeah,
I mean,
yeah,
that'd be cool. I mean,
Yeah.
it's good.
that would be a cool thing.
Yeah. Yeah.
All right.
Next, we have a September 10th afternoon field trip, coincides with our next meeting.
Yeah.
Yeah.
After our day meeting, right?
Yeah.
Yeah, so the idea is, we'll have our day meeting, and when we get done, maybe grab some sandwiches and go out and do a field trip, check out some of the Sunnyside property that is now county property.
Yeah.
So
Dennis is coming.
Dennis is coming.
Good.
This works for him. Anthony's coming.
Good.
Yeah. So I wanted to.
And we're not visiting, we're not trying to hit them all, but we're trying to hit.
We'll get what we can get, yeah.
Yeah.
I mean,
Yeah.
yeah, and I just wanted to put it on the agenda, see if that worked with your guys' schedule.
Oh, yeah.
Yep.
But before we run out run out of season here.
Right out of summer.
Yeah.
Yep.
Yep.
And we'll just talk about this one too while we're at it here too. We also have our joint meeting with Hinsdale County on September 5th. We set the date. We do not have any further details.
What's that?
We do not have any further details as far as I'm aware.
Oh,
about-
really?
Yeah, well, yeah, just about what to bring and who's all invited and.
Yeah.
I've got it written down too, but yeah, you're
Yeah,
right. We don't know.
We've got it written down, but
We don't know when we're
yeah.
going to Cinnamon. We don't know.
Yeah, we're
Leaving
going
the
to Cinnamon.
courthouse leaving courthouse at 10.
Yeah, but we don't know if we're bringing food or, or our whole road and bridge department or, who else.
Oh, done. Okay.
Yeah, so we'll try and dial that in, but since this is our last, regular meeting before then, we'll have to communicate outside of the meeting about those details.
Yeah, we'll try to get some details.
Yeah.
Sure.
I'll try and
Get a reach out to her.
Yeah.
Okay.
Yeah, any other, upcoming meeting things you wanna? I think that's it, but
Yeah, I do have one more item.
yeah,
The state electrical inspector, did his inspection on the hospital building, everything passed with
done.
flying colors, it's done.
great.
The temporary lines have been pulled, the poles have been patched, and painted, and the heaters are working, and I should have asked Becky, so the other day when it was a little cold, she was sending out text messages, it's so nice over here.
Yeah.
Yeah.
So,
Yeah.
and, so, yeah, we'll see how it works. but-
Thanks to San Miguel and Dennis, Kurtz and Lauren and the whole deal.
Yeah,
Unbelievable. The issue we don't have to worry about this winter.
Yeah, so.
yeah. That's great, and yeah, so the only building that we need to, knock on wood that we'll be able to heat this winter is this one. The rest of them should be all right. At this time, we'll go ahead and open the meeting for public comment. If there's any members of the public who would like to comment on any county business, please do so now. Seeing no public comment, we'll go ahead and close the public comment and open up commissioner and staff reports. Pete, you have any meetings or anything you'd like to update for the county?
AAA is in distress, I will say. Keeping up with it. Still haven't got a real director. Had one and that fell through. So as I keep up, I'll let you know. Okay. I mean, it's going okay, but they came up with a resolution to knock some people off the rack board. It included Martha Johnson, which that was why, right?
Yeah.
But it's all about the bylaws are all about how many years you've been on there. So I'll let you, it's not done with yet, so I'll just keep you informed on that. It's a tough one. I did hear some different things. Social media, Facebook, people coming at me. Oh my goodness, I can't believe you're closing a county road for this or that. What's going on? And all it was is Little Giant that we're all aware of.
Yeah.
And I think it's fixed now, or it's in process.
Yeah.
Close. It was extremely dangerous. And so I gladly corrected some folks on that.
I saw some pictures. They're working on it. They're
Absolutely.
I think the weather slowed them down a little bit this
Right,
week,
but
but
another week or
they're
so,
working on it, yeah.
another week or so it's done.
Yeah.
But I mean,
Yeah.
people were, as they get, all up in arms,
Yeah.
and there you go.
Yeah.
So other than that, road and bridge is going decent, and those guys are rocking and rolling, so.
Yeah.
And they hasn't decided on this, it's Labor Day this weekend, that takes a lot of pressure off. They have, as soon as Rusty will report to us when he's going to do the County Road 2 thing. And he's gonna report to all the business people and up and down County Road 2, the brokerings and everybody else on that, so.
Yeah.
That'll be fine, that'll be
Yeah.
fine. I actually did get a compliment from Laura Kelly,
Oh,
who, you know, the little bear house.
yeah, yeah.
On the condition of the road this year, which
She's liked it.
she did.
All right, that's great.
I don't get positive comments a lot.
That's the first.
It was awesome.
That's the
and
first one from her in 5 or 6 years. So
right.
that's great.
It was awesome.
Yeah,
Yeah.
And it's a work in progress, and I think
Yeah.
that's good news though. That
It is good news.
Yeah.
That's all I got.
All right. I had the regional CCI meeting, where we talked about 2026 legislative priorities, but got to spend some face time with some of our neighboring counties commissioners, so that was good. Had one personal kind of thing there, sort of personal, but related to our county and our neighbors in Uray, with the Rocky Mountain Alpine Lodge folks. Just there's
parking.
Yeah, parking. They wanted a little bit of input from parking and a little bit of information from us, and I'm working on trying to get some of that information from some of our county staff, and I think there's still the temperature to have a stakeholder meeting there and talk about some of the things on the top of red. I think with our CDOT meeting, and hearing that they're going to be working on improving the parking issues on the top of red, I think that's positive.
All right. Probably won't happen this year, but it's gonna.
Yeah,
but it's in the process. That whole area, we know where that is.
Yeah,
that could help.
Yeah, and I don't want to speak too much to Uray's things there, but they're working through some issues up there too themselves, and they want our support, and they want to have a meeting. I didn't think that they've just been chasing their tails for too long with their own things to do, but I think one of these days we'll.
It's fun. I talked to one of them too. And it's amazing the problems they have over there.
Yeah,
we're not the only ones.
Yeah. Yep. Yeah. Truer words were never spoken.
Yep.
At the meeting, unfunded mandates, huge issue. Mason County's leading a big push for counties to join and support protests of unfunded mandates with the state and the governors. We're certainly invited to take part in that position, or express anything that we have. I think if we want to take a more formal position and join the unfunded mandate discussion, we should have our other commissioner here to talk a little bit about it. But I don't think it's a emergency thing, and I think it's going to be a long drawn out ordeal for doing that. The legislators having a special session right now. Really hoping that I didn't get any word from the CCI staff that they had anything specific to early child care and the funding, but did let them know about what we were facing with our family learning center, and so they are at least aware. And if they hear of anything, we have people at least aware of the situation, and childcare is a hot button topic in a lot of different communities surrounding us too. There were at least 2 other counties that were putting measures on the ballot to increase lodging tax for supporting early child care as part of that. La Plata was big into that support, and they're actually going to be putting an issue on the ballot for raising lodging tax for more for roads, for funding for roads, in that issue too. So that's an expanded use thing that's going on. Fire is just we're so lucky here compared to our neighbors. Every other county has had at least a minor fire in their county. So we're consider ourselves very lucky that we've weathered this dry spell and this drought pretty scot-free compared to a lot of our neighbors. We went through about 30 or so initiatives for CCI. I'm not gonna go through them all tonight. But we did kind of, CCI and the Western Slope, kind of representation at that meeting, we were pretty on board with the same issues. The CCI staff said it was a lot less painful to work with that group of commissioners than it was to work with and representatives from their counties than it was to work in other portions of the state, because we all kind of had, we all, it was pretty easy to get agreement on what were the major issues and what the focus for CCI should be as far as our lobbying dollars are worth. So when it comes to the general meeting and getting all together with our neighbors in the other slopes, we'll see how those priorities all kind of shake out. But
When is that main? Is there a winter meeting coming up?
Yeah, usually November, right after,
I thought it was early December this year.
it might be, it's usually.
I'd like to go to that.
It's usually that
You won't go?
After,
Yeah, if we can go, I'd like to go.
after Thanksgiving and stuff like that.
You know where it's at?
Usually, well, I don't, usually it's in Colorado Springs, but I don't know, I haven't seen anything yet.
I didn't see anything specifically
Okay.
related to where
I think it's time
was,
for me to
but yeah.
go.
But yeah,
again.
it'd be good.
Yeah.
And yeah, there were, there were a few counties that had a couple commissioners there. I don't think there was any county that had all three there at the Western meeting, but it was good. There are a lot of folks that I've, seen on Zoom and talked to a whole lot. Other things I didn't realize are in our neighbors to the south, Commissioner Church in La Plata is gone. And so I got to meet his replacement and yeah, so it was, and
Was he appointed or?
she,
Special seat?
I believe is appointed, and she is going to be running for real
Right.
cycle.
Yeah.
So,
Yeah.
I knew Clyde, he had to get off AAA too. His
yeah,
got a
yeah,
wife health problem.
yeah,
Yeah, it's kind of sad.
Good guy too.
yeah. A lot of years of service, and
Yeah.
but we appreciated, and he was one of our main contacts for that group during COVID. So when we meet for that regional commissioner group, he was kind of our main La Plata contact there. So gonna be sad to miss him, but yeah, it was yeah, didn't see anything glaring for San Juan County in the legislative issues for 2026. But yeah, as it comes through, also just kind of reiterated too that as the special session comes and things happen at the state legislature, they can happen pretty quickly. And so I think this is kind of the time that a lot of the commissioners like to be really alert of what's going on at the legislative session.
Absolutely.
Probably the best news was that DOLA, as one commissioner requested, should make it rain next year. But they are going to be having some funding coming back. They're going to prioritize finishing and wrapping up major infrastructure projects that got paused. They're going to be accepting some new applications for infrastructure improvements in 2026. The Main Street grant cycle and things like that are coming back, but the state is the grand pause of DOLA funding is going to be is hopefully going to start coming back in 2026.
That's good news.
Yeah, that was the only ovation of the day was that.
Yeah.
So it sounds like the state is at least in 2026 going to be a little bit more helpful than they have been in 2025. Yeah, I think that's all I have. Okay, cool. All right, I think we'll go ahead and if unless Dennis or Willie, unless you have anything, we'll go ahead and adjourn this meeting.
No, thank you guys. Good meeting. And yeah, Willie and I are working on some things, and we'll keep working on some things.
Sounds good.
Thank you, Dennis.
Yeah, thanks, Dennis.
All right.
All right, we'll adjourn this meeting at 9:15 p.m. Thank you. Yeah.
Okay.
Did I learn?